Hello. Well, it's done. I don't think it looks too bad. I think she's made a pretty good job of it. Was it worth it? I don't know. So what happened today? So my appointment, she were running 55 minutes late. So the longer that I was sat in the waiting room, you can imagine what was happening to my heart rate. My smartwatch, my Galaxy Watch, were actually flashing that my stress levels were high. My pulse rate was really high. There was a lady, poor woman, who was there to have a tooth extracted, and just as soon as I heard her say that, and she was sat there waiting, she'd had the anaesthetic into her gum to numb it. She was out in the waiting room. I was crying for her. I just couldn't believe it. I mean, to be fair, she went in and came out. She was in a while, but she came out and she was perfectly fine. Me, on the other hand, I think I must have been having all the symptoms for her, to be honest. So the procedure itself, it did take about the 20 minutes that she anticipated. The temporary tooth had been attached so well that she struggled to get it off. She had to physically use the drill to do that. So there were a lot of smell of burning while she was doing that. And the dental nurse was using the water to try and keep things, well, I don't really know why they use water to keep things okay. I can't explain that any better. At one point I did have to ask her to stop because there was that much water going down my throat and up my nose. I couldn't actually breathe. So we did actually have to have that one little breather. I suppose what other bits didn't I like? When she was attaching the tooth, there's a lot of pressure there when they're putting the cement on and trying to keep it in the right position to make sure it stays in place long term. That was not very nice. And then the final thing, which I'm thinking, oh my Lord, what a wimp you are, Julie. She got a piece of floss and she wedged it kind of between these gaps here and here to make sure all the cement was out. Oh my God, I can't even describe what that were like. She said it's only floss. But the pressure between my teeth were just awful. I don't use dental floss. I actually use a water flosser or a water pick because I just can't put any pressure on my teeth whatsoever. Anyway, it's done. She also repaired the filling that had come loose. That went absolutely fine. It were over very quickly. So that's it. I've tried to phone the dental hospital regarding that appointment that's been cancelled for next week. Surprise, surprise. Our lines are busy. Please try again later. So that's today done. That's one trauma that I don't have to face for a while now. Fingers crossed that there's no dental treatment needed now for a long time, apart from getting these two teeth out at the hospital. Once again, thank you for listening, and I'll keep you updated as I go through my CBT.